Hello, are you ready for a behind the scenes look at the specific diagnostic tools that we use with NUCCA? I'm Dr. Justin Koop. And again, NUCCA stands for the National Upper Cervical Chiropractic Association. And today I want to go through x-ray. We use very specific diagnostic tools, state-of-the-art diagnostic tools to help us determine exactly how an individual is misaligned and then the best way to correct that misalignment. So again, today we're going to go over x-ray, and I'm going to show you the before adjustment x-rays and the after adjustment x-rays. So here are the x-rays, and what we're looking at is on the left side of the screen, the pre-picture. So when we look at this image, we can see the lines are representing overall misalignment. And so with this individual, we can see the head's tilting to the left, the neck's angled to the left. That line going across the center screen is their atlas, the first bone in the neck. And we can see it's tilting up on the right, down on the left. The picture on the right is the exact same person after their first adjustment. So these images were taken within a week of each other. It's just a pre and a post. So the one on the left is prior to the adjustment. The one on the right is immediately following the adjustment. So you can see the one on the right, the lines are very symmetrical. We're seeing almost a perfect cross or T. So there was a significant correction in the overall alignment of the atlas, the head on top of the atlas, and the neck underneath the atlas. And so this shows us that we had a very good correction, which is exactly what we want to achieve each and every time we adjust. Okay, and here we are looking at a before and a post. So the x-ray that over on the left side this is the x-ray that we take following an exam to see exactly how a patient is misaligned. And we use this x-ray to do specific calculations and allow us to know the best and most precise way to adjust and correct that misalignment. So this is the before, and you can see when we look at this x-ray, the yellow lines, they should make a perfect T or cross, and well, they are not oriented that way, so they are not symmetrical. We can see the head is tilting to the left, the neck is angled over to the left, the center line that goes across the screen is angled up on the right, down on the left. So this is the individual's misalignment. Based on this, again, we're going to do a very specific adjustment to correct that misalignment. Immediately after the adjustment, we're going to take a post x-ray. And so the image here on the right is the same individual less than a week later after their very first adjustment. And you can see the lines look very symmetrical. So this is a very good correction of that misalignment. The head is perfectly centered over the neck, and the atlas is balanced in the center as well. And so this is, again, a very good correction, and this is what we want to achieve with every patient whenever we adjust. But we always look what is going on prior and see it in a 3D image and calculate that adjustment, and then we do a post to make sure that we're getting the best correction possible for that individual.